So because of the government shutdown, the government is not going to have enough, doesn't have the money already allocated for food stamps. So they'll probably be cutting food stamps next month. There's about 6 billion actually allocated for funding this upcoming next month, but they're going to need $8 billion. So because they don't have all of the money, it's expected to affect about 40 million people who currently use SNAP, Supplemental Nutrition Assistance Program. And because they don't have the money already allocated, they're saying that some people, mostly women, the elderly, and not women, single mothers, the elderly, and children will be affected. It's also going to affect students who get free and reduced lunch in public schools. I support some of what the Republicans are doing. They're trying to cut some of the spending that the government is using to pay for welfare programs. And one of the stipulations that the Republicans have put in the big, beautiful bill is that they want able-bodied men to work. So though I support that specific point in their proposal, I disagree with the harm that it's causing federal workers as well as women, children, and the elderly. So myself, like the rest of Americans, would like the Congress to get back to work. They've now been out of work for 3 months and nothing has moved forward in terms of them finding an agreement. So the effects are just affecting more and more people. Last week and a couple weeks ago, we covered people, the air traffic controllers and other people who work in the government, the IRS, as well as contract workers. And now the effects are going to be hitting people who don't even work in the government, but it'll just be hitting low-class American citizens, not low-class, but low-income American citizens who rely on government funding to get their food and to get their meals at a reduced price. Outside of the people that we've already named and people who are losing food benefits, the Kentucky governor spoke about the effects that it's going to have in rural America. He speaks about specifically the cuts and how they'll affect hospitals, but they will also affect other economic things in rural America as well. This is the governor of Kentucky, Andy Beshear.
How will the big, beautiful bill affect rural folks in Kentucky?
Oh, it's basically punching rural America in the face. It's going to devastate rural economies because it's going to close or significantly impact rural hospitals. Every one of my rural hospitals is the #1 payroll in their community. And so if you eliminate a large part of that payroll, you don't just close the hospital. You close the local restaurant, you close the local coffee shop, and you close the local bank. You can't take $1 trillion that's flowing through rural America out of it and not expect people to be impacted. But then there's the workforce. So right now, if you've got a clinic, you can miss a couple hours of work and see a doctor. But if you have to drive 2 to 3 hours, you're missing a day. And then you take your kids and then you take your parents. It's going to profoundly impact America in really negative ways.
So this is what I was kind of alluding to earlier. The cuts are just for things like welfare, Section 8 housing, food stamps. But when you affect anyone in America and you affect the workforce, the essential workers, it ends up affecting those outside of the initial people harmed. So basically what he's saying is that once you close the hospitals, now the workers aren't working. Well, if the workers aren't working and the hospitals aren't working, now it affects tourism. Then when it affects tourism, it affects the hospitals. So now people, hotels. So then people who work at the hotels are affected. So what the governor is saying, and what I also believe, is that though you're trying to assist with one problem, we do have a budget that's a government that's spending too much. The way they're going about fixing the problem is going to cause harm that extends outside of the intended groups. So he's saying that the workers in rural America will be hurt, but also in the inner city, people are going to be hurt. People who aren't able to get their food may go to crime, which could raise crime. People who are going to work, but if they don't, students going to school and people going to work who don't have the proper nutrition, now they're not operating at full effect. So you'll have workers who are disgruntled. You have students who aren't ready to learn. It just impacts more than just the intended group of people that it's supposed to harm. So Andy Beshear I'm assuming, would like the government to get back to work, and so would the American people. We understand that in terms of healthcare and the Affordable Health Care Act, the Democrats and Republicans are a long way away from one another. But They haven't been working for 3 weeks, so the only way we're going to get somewhere is if they open Congress back up. So politicians, you need to open Congress back up so we can open the government back up so people don't lose their welfare, welfare benefits, but food stamps, and so that the other Americans who work in tandem with those who receive these benefits are able to do their jobs as well. If you like this video, please smash the like button, comment, and subscribe. New shows airing Monday through Thursday.